or horizontal abduction, so they have to, put on deodorant, reach behind their back, fasten their bra strap, or tucking in their shirt. This is a great technique to help restore that. So yeah, pay close attention to this one. And as far as going through the grades, I'm going to show you guys them in order. So we're going to do a grade 1 course first, okay? So basically what you do, and you always want your patient to be a little bit closer to you, that's one over here. And all these techniques can be done in seated. I'm just going to show you for the sake of this how to do it in a standardized position. So what you do is you just gently lift your arm. Okay, and I always cradle it kind of between my arm and my stomach there. You okay? And then your mobilizing hand is going to go right over the humeral head. Okay, can everybody see where my hand is? And then,
drop your knees.
So a grade 1 is basically, so I've got my left hand underneath her arm. I don't know if you guys can see that. Right hand on top. I call it like the snowball making position. You're almost kind of packing a snowball like this. You got one hand underneath, one hand on top, and it provides a lot of support. And this hand, your left hand and your arm, it's just going to be hanging out there. You're not going to do much with this. Everything's going to come through the right hand. Just going to lay it on top of the shoulder. So a grade 1 force, you're just gently going to put a little bit of pressure down. Okay with that? And she can tell you, as I'm doing this, I'm just providing a little bit of oscillation. So I'm kind of going like this, just a little bit. So that's a grade 1. So I'm barely going into her range. Okay? A grade 2, so I go through where I was doing before. I'm just going to stay there. I'm going to push down just a little bit more. That's a grade 2. So right there, a grade 2 is about halfway through her available motion. The head of her humerus is only going to go so far down before it stops. Where it stops at is where the barrier is. Okay? And that's where your grade 4, you're going to do most of your mobilizations from. So sometimes what I'll do to determine where that is I'll come in and I'll just do a gentle push down, where you're nice and relaxed. So right there's where she stops. Okay? That's where her artificial barrier is, or where her real barrier is. I'm not sure if you have any shoulder limitations or not. But, okay, so that's where she stops. So like I said, grade 1, you're barely pushing down. You're just applying a little bit of pressure. You're oscillating. And you can do these techniques for 30 seconds a minute. Grade 2, push down a little bit more. Still doing well. And then from grade 2 to grade 3, you're taking it almost right up to that barrier. So we'll go a little bit more. And all I'm doing is just kind of bending my knees and just dropping my weight down. Not even really pushing much with my arm. Just kind of leaning down into it. Good there. Grade 4, same thing. I'm just going to put a little bit more pressure on. Right there's her barrier, so I'm just kind of mobilizing into that. Okay?
Yeah.
So nothing crazy, very subtle movements. But what we should have done is had you reach up or reach behind your back, do the technique, and then test it again. And you always want to do an assessment first, do the intervention, do the hands-on technique, and then retest. So that's just one example of how to use the grades. And we're going to show you this on a bunch of different techniques.
Are you distracting the joint at all, or no?
No, not for this one. This is a straight posterior glide.
Okay.
I'll show you distraction while we're here, though. So for a distraction,
Yeah, I'm sure that felt good. Go ahead.
So basically for a distraction, once again, I'm not going to get into details about what the open pack position is for the shoulder. To keep it real simple, if you take the arm out to the side, come up to a little bit of flexion, it's right here. There's 55 degrees of abduction. I'm not going to get into all that, but basically cradle the arm, and for a distraction, grab underneath the arm, grab on top of the arm, and you're just going to lean your body weight back. Okay? Good. And you're just going to hold there. You can oscillate. And same thing with the distraction. You can do a grade 1 distraction, so I'm barely pulling out. Okay, just holding there. Doing a little bit of distraction. Coming out a little bit more. A little bit of oscillation. Grade 3's right here. Grade 4. Now I will say this. The research has shown that a grade 4 mobilization is where you get most bang for your buck. You can do a grade 1, and sometimes you may want to do a grade 1 just to have the patient, get used to having your hands on them. They feel comfortable with you. But to actually make an effect at the joint and improve their motion, you really want to try to get up to about a grade 4. And did you have any pain with the grade 4? Feel pretty good?
Actually, no,
Good. So most of the time, most patients aren't going to have pain. Now, if someone has like a long head of the biceps irritation, or let's keep it simple, they have pain in the front of their shoulder, there's other variations. Instead of pushing down right on that painful area, you can bend the elbow, rest it across here. Just slide your hand down a little bit lower, and you push through the elbow. So there's other ways to do these techniques where you're not pushing on the painful area, and you're still getting what you need done. So, we'll show you some more variations as we go through, but does everyone kind of understand the grades? Keep it simple. Grade 1, you're barely pushing into the range or pulling. Grade 2, you're going up to about halfway point. Grade 3, you're coming just short of their end range. Grade 4, you're just gently pushing into the end range. That's the easiest way I can explain it.
If you start off with a grade 1 just to get for the time to get used to you, is there any contraindication if you go from grade 1 to grade 4, about 1 to 2 and 3?
No, because actually as you go down through, you're going to be hitting those areas. As long as the patient can tolerate going to grade 4, I would say go for that. They say, that's a little uncomfortable. It may not be that you shouldn't go to grade 4. You may just have to adjust where your hand is, or that type of thing, or adjust their positioning. But if you can get to a grade 4, that's ideal. You're going to see the most results with that. Any other questions? Go ahead.
I just want quickly, with the grade 1, do you need to oscillate, or is that optional?
They recommend that you oscillate.
Okay.
They recommend, and grade 1 specifically, it's a little bit quicker of an oscillation. I mean, you're not going to be shaking around like crazy, but it's just it's a little bit quicker. Yep. Grade 4, they actually say more of a sustained hold. So when you get them to a grade 4, you're just basically letting your weight lean into them, getting a little bit of stretch on the joint capsule. Because really, as you go through those grades, the only time you're affecting the joint capsule specifically is when you get to a grade 4. You're actually stretching and creating a motion.
So when there's all that osteoarthritis and stuff in there and all that like crepitus and grinding, you're just supposed to go through it?
Well,
Because
yeah.
that's the scary part, because you feel all that and you're like, and you feel their bones moving, and I mean, I know for me, I'm like, and that's where I'm like, please.
Great question. And we deal with the same thing. You hear a lot of clicking, grinding, all that kind of stuff going on sometimes. And if it's a very elderly patient who may have significant osteoporosis and maybe has previous fractures, I'd say your best technique for the shoulder is going to be distraction. Because there you're just separating the joint surfaces. You're taking pressure off tendons, ligaments. You're creating a little bit more space. You don't hear as much clicking and cracking. And in that case, this is a great technique. And we'll show you a way to do it sitting as well. But you just lean back, you separate those joint surfaces, you can oscillate. And I've never had a patient that doesn't like this.
Yeah, this is great.
So,
I know, I'm
so
next.
it's a very safe technique to use, especially on a patient like that.
Yeah, that's me. That's my patients, every one of them.
Yep.
Yeah.
Can I ask you a question about documentation of this?
Yeah, absolutely.
I always just call it joint moves. I don't go into calling it distraction, or is that acceptable, or should we be describing more that we're doing the joint mobilization with the distraction and the braids?
In an ideal world, you know how it is with documentation. The more specific you can be, the better. You could probably get away with saying, I'm doing a joint mobilization for the glenohumeral joint, or I'm doing a distraction for the glenohumeral joint, and you can just say grade 1 through 4.
Okay.
You can, because that way it gives you flexibility that you kind of are working your way through the grades.
So I'm thinking I'm not being specific enough now that you guys are talking in the terms. Yeah. And oh my God, my documentation stinks.
Well, if you're doing hands-on techniques, you're well above a lot.
Okay, well,
That's a good
Yeah.
But yeah, I mean, if you can